We conducted a study with 427 participants, assessing their quality of life, their life satisfaction, and other psychosocial outcomes, as well as medical comorbidities and clonal hematopoiesis in a long project. It took us about 3 years to collect the data. And what we've seen so far is, overall, if you compare all of our survivors with the general population, quality of life seems to be quite comparable. There doesn't seem to be a lot of difference. But what you do see is a tail of participants that still report poor quality of life. So it's about a quarter of them. And those are the patients that we focused on a little bit more in the next step to see if we can assess any risk factors, anything associated with those. And we were able to identify some. We're still kind of in the middle of figuring this all out, because we first put all the variables in. What we see is that they highly correlate with fatigue, with anxiety, and stuff like that, but questionnaires correlate with each other anyway. And so in the second part, we're right now trying to just put impact factors like social status, like income, and all of that, and see what we can find here, because the other impact factors would be hard to reproduce for, like, say, an aftercare visit. So he wouldn't know the fatigue of the person and then know their quality of life, but he might know, like, the age, the sex, their social status. So we're trying to find factors that would be helpful for the aftercare for them. And what we see for life satisfaction is actually quite interesting. If you look at health-related life satisfaction, it's kind of the same like quality of life, but if you look at general life satisfaction, there seems to be a different set of impact factors, totally different from disease-related or treatment-related factors. So we assume, or we think, that it might be possible to resume life satisfaction after disease, but still report poor quality of life. So we're still trying to figure out if we can differentiate the two from one another. So we took a look at anxiety and depression as well in those participants. So we used the HUTS. It's a very common tool which gives you an anxiety and it gives you a depression score. And then you can divide the participants with low depression, borderline, and then high, and the same goes for anxiety. And what we do see is that we do have a subset of participants that report high anxiety and high depression, just as well with the quality of life. And we do see some associations with that. We do see associations with financial burden due to disease. We see impact of work, or not being able to work anymore after disease. So we're really trying to figure out hen and egg. So are those symptoms coming from being not able to work, or from having your financial situation worsen, or is it the other way around? How are those connected? And we really see the importance of focusing on the financial needs of the participants, because we see a really nice correlation between having low income and worsened financial situation and depression. So we feel like that could be a point for targeted intervention, like helping those with financial adversities or structuring more social support on that end. Social workers may be getting into place, helping them with disability benefits, etc. But we're still, again, looking closer into that, where we can actually find like a point where we can help those.